We're watching live Impact News on WCNC Plus. Want to switch gears here a bit and take you from that previously recorded press conference yesterday from the attorneys general talking about fentanyl to another medical challenge, if you will, for the Carolinas, especially in North Carolina, where we do know that medical debt is affecting and really 13% at least of North Carolinians drowning in medical debt. And we're not just talking about major surgeries or extended hospital stays. These are often single unexpected bills with these four-figure balances. Want to bring in right now Steve Speranza. He is the CEO of HealthLock and major leading medical billing expert, right? Scott, wanted to bring you in. Thank you for joining us here this morning.
And thank you for having me.
How did we get to this point where so many Americans are affected with medical debt?
Well, you got to put it into context that our healthcare system is really the best in the world. You get the best care, and one of the things that makes that possible is health insurance. It's not government paid, it's not subsidized to the extent of the private market. And so the insurance does create complexities. It does create things like denied claims and payments between 3 or 4 different parties, with the lab, the provider, and so forth. So that complexity does have its effects. And again, the consumer certainly has the ability to navigate that, but it's difficult and challenging.
Yeah, I mean, so what is that first step when folks get this unexpected bill and the shock they must see, right, when they get that in the mail?
For sure, right? So the first thing is, we call it at HealthLock pre-care. So before you go to care, make sure that you're doing the things to understand what your insurance covers, what it doesn't cover, the emergency services that are close to you. When you go to the doctor, you've got to have your eyes wide open as a consumer and ask, what are the procedures we're going to do? What are the lab tests that we're going to get? And the doctor in the facility will help you to understand what's in network, what's not in network, to ensure that there isn't this surprise large bill or expense. You also have the No Surprise Bill Act that will also provide some protections. But for the most part, 40% of issues are still in network, not out of network. 30% of Americans are going to receive a denied claim this year. 66% of bankruptcies are still due to medical bills. That's up from 61% pre-COVID. So there are definitely issues and statistics that make it challenging for the consumer. But again, we're not powerless, and we certainly have the ability to protect ourselves.
When we do get a bill of this nature, we've seen errors. What are some of the errors, the most common errors that people should look out for?
Yeah, unfortunately, statistics show that there's potentially 40% or more of bills have some form of error in it. Now, that doesn't mean that every bill, an error is a financial error, but certainly at HealthLock, we see that a lot. So you've got this, complex coding system called CPD, ICD-10 codes. It's like the IRS tax system. Each code is effectively, assigning what procedure was done, and then a price point. There's over 100,000 lines of codes. It's actually more complex than the IRS. And so when you think about, we need an accountant to submit our taxes, again, certainly some of these complexities, especially if you're going to go into a large care, you might need a third party like HealthLock, of course, to help you navigate that. But the issue is, it could be a duplicate bill, it could be a duplicate service, it could be a wrong CPT code, it could be upcoding, it could be some kind of nefarious fraud. The thieves have really moved over to medical, where pre-COVID there was 2 million data breaches. Last year there was 184 million breached patient records, costing Americans over $350 billion. So again, we have to have our eyes wide open. We've got to understand what the billing and the procedures done were, and then work with your provider and your insurance carrier to make sure that you've got the most effective pricing and the most reimbursement from your insurance company.
What documentation should people keep then as they are going through whatever situation? Because people are quick to throw out. I know I throw out a lot of mail now because most of it comes through email.
Well, you've got your famous explanation of benefits, right? That's the EOB that the insurance company says, this is not a bill. This is the way that the insurance company that you're paying for the coverage sees this transaction and what you potentially owe. And so that's really that's not the start. The start is when you go to the provider to get as much information and pre-authorizations as possible. That's the first step. Second step, again, is to have your eyes wide open, asking questions on what you're going to do, what procedures, is that covered, is it in network, are all your doctors in network? And then third, when you do get the explanation of benefits, make sure that it looks accurate. And if not, you've got to first call the insurance company and find out what's the reason that they've articulated it via the EOB the way they did. And then you work with the provider or the lab, the hospital, the emergency care, the urgent care, and say, look, this transaction seems to be very, very challenging in the sense of either too high or a partial denied claim or a denied claim. One of the things, of course, that makes HealthLock effective, we've saved over $200 million now for our customers, is that we use data. So instead of calling an MRI and saying, hey, I think this is too expensive, HealthLock calls and says, look, we've got prices between $500 and $2,500 for the same procedure. We're not sure why there's such a difference in pricing, but we want that $500. And so we can negotiate from a standpoint of empowered data, not just we pay a lot for insurance, so we need a discount.
How do you know when you need help, such as HealthLock?
Well, there's two facets. One, again, is the fraud I mentioned. So just like identity theft, you've got proactive monitoring. HealthLock proactively monitors your doctors, your providers to make sure that if there is a data breach, you're notified of what happened, how many patient records were breached, and then we protect you. We protect your medical record, we protect your out-of-pocket costs, and so that's part of the protection strategy. And then also we have an innovative first-to-market solution, which is we automatically monitor and verify all your healthcare transactions automatically. So you're not sending us paperwork, you're not having to worry about it. Our customers literally just wait for HealthLock to say, hey, good to pay, and they pay it or flagged, and we go ahead on our own and save them money, again, leading to a substantial savings for our customer base. So, really, we try to make it as simple as possible and safe and secure for the consumer. That's what HealthLock does.
All right. Could be a scary situation out there when you get those unexpected bills. Anything else that people should know?
Well, if you do get a denied claim, just make sure that you appeal it. Only 1% of folks actually appeal their denied claim. Certainly the provider will help you. Again, you are going to the carrier. They are the ones that denied the claim. 30% of Americans are going to get a denied claim. But just make sure that you first appeal it. Don't be passive as you're managing your dollars in your healthcare.
All right. That's a good protection piece right there. All right. Scott Speranza from HealthLock, thank you so much for the morning and some good information there moving forward with medical debt. Could be quite the hindrance.